can be an issue. Stroke could be a problem. Congestive heart failure and change stroke breathing could be a problem. And sleep apnea in general is a risk factor for atherosclerotic issue. This is data from a paper published in New England Journal of Medicine in 2000 showing the incidence of hypertension within 4 years according to the apnea-hypopnea index. So as the severity of apnea-hypopnea index goes up, so as the incidence of hypertension, a direct relationship with the severity. This is an important slide related to the long-term cardiovascular outcome in men with obstructive sleep apnea syndrome. This is a busy slide, but I want you to concentrate on certain aspect of this slide here. Here, the data is a long-term data for about 144-month duration, and then in this study, what they have tried to assess is the risk for fatal cardiovascular event, and they compare it with the control population, people who do not have sleep apnea, people just snoring in black, mild sleep apnea syndrome in red, and then severe sleep apnea syndrome in this color, and obstructive sleep apnea syndrome with CPAP treatment. And you could see that one thing is standing out is the people with the severe obstructive sleep apnea syndrome. With time, the chances of fatal cardiovascular event is much higher compared to any other population. And you could see that people who are treated with the sleep apnea, they are close to baseline. The other thing which is here is the non-fatal cardiovascular event. And even in the non-fatal cardiovascular event, the same phenomena goes on. Thing which you could see, another thing here is that people, even with the mild sleep apnea syndrome who are symptomatic, they are much higher, they have much higher risk for developing fatal cardiovascular event compared to the control. Again, there is an implication that obesity has multiple role to play. It may cause problem with the diabetes, metabolic syndrome, obesity, and this is some kind of vicious cycle which feed each other. It's a common risk factor, include age and obesity, causes diabetes, sleep disturbance, impaired glucose metabolism. There's a vast majority of the data available related to this. Common inflammatory cytokine including IL-6, human necrotic factor alpha, likely to have an effect, but mechanism and magnitude so far is unclear. How to treat this monstrous condition? What are the things which we can do to help our patient? There are conservative therapy which can be started early, but it's not always effective. But it's important to know and educate our patient about that. Definitely, if you are obese, weight loss should be the part of the mix. Avoidance of the alcohol, smoking cessation, position of the body. If somebody is sleeping on the back and have significant sleep apnea and we do not provide treatment for whatever reason, ask them not to sleep on the back and try to sleep on the side or prone position. And treatment of the nasal obstruction, which can also further increase the problem. Specific therapy for the sleep apnea, the most common and most effective is CPAP, which is continuous positive airway pressure treatment, and that could be started. And if patient is able to tolerate, this is the best treatment you can give to the patient. And people are usually very thankful to you if they have the sleep apnea is the only problem, and if you take care of the problem, they feel that they are basically reborn. They have so much energy they never thought about. Because the sleep apnea is an ongoing process, and a lot of people even do not know whether they are suffering from any kind of ailment unless they see the contrast. If you could not treat the patient with this CPAP, then oral appliances which could be made, custom made by the oral surgeon, and the whole objective is to manipulate the jaw and move forward so that you could open up the air passage in the back of the throat. And the third option is ENT surgeries and facial-maxillary surgeries, and there are a whole bunch of different surgeries, including UPPP and some laser therapy to the soft palate, some paler procedure, some trimming of the tongue, and then mandibular and maxillary advancement surgery, which very few people usually opt to pursue. Now, in conclusion, education, 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 both for the patient, PCPs, which are primary care providers, and specialists, to recognize and understand the importance of the obstructive sleep apnea syndrome. OSA is strongly associated with cardiovascular disease through epidemiological and clinical studies. Best evidence to date support a causal role of the OSA for hypertension. OSA therapy may reduce the risk for cardiovascular diseases. Moderate association between obstructive sleep apnea syndrome and diabetes, and sleep duration effect on is a consistent finding, but mechanism is unclear on the basis of the treatment for the diabetes and the role. PAP therapy may affect diabetes. How it does that, we don't know. But I have seen patients who the primary problem of them was either the morning hyperglycemia, rest of the time they are very controlled. What happened is during sleep, when they have obstructive sleep apnea syndrome, there is a release of catecholamine and lack of insulin causing the blood sugar abnormality. Once you treat them, you have a better outcome as far as their diabetic control. Thank you very much for your time. If anybody has any question, please feel free to ask. Otherwise,